Hi again, dental assisting students. Welcome back. We are now off to chapter 26 in your textbooks. I think that is learning outcome number 12 on eTuto. So this presentation is on eTuto under fixed prosthodontics. Okay, so chapter 26 deals with dental implants. So dental implants form part of removable as well as fixed prosthodontics, or can be used in both instances depending on the type of appliance that you have decided to go for or your dentist has decided to go for as part of a treatment plan. Okay, so dental implants have a very high success rate. It's very seldom that they they fail. Okay, so in that anterior teeth, basically the success rate is from 90 to 100%. With the posterior teeth, it's from 85 to 95%. Normally this drops because of the involvement of the mandibular nerve, and then success is also dependent on the load that the implant carries. So as long as your dentist has strategized properly and has determined that this implant as well as the underlying bone can manage the load that he or she intends on placing on the implant, everything should be okay. So like I mentioned before, failure is rare, hence they're so expensive, and also because the technology is new. Reasons for failure would be things such as the soft and the hard tissues may have infections or inflammations. That's why it's very important that before we even start the process of placing an implant, we make sure that all the soft tissue as well as the underlying bone is in good health or in a good condition. Then from there, another one is that it did not heal properly. Normally, this could be due to various reasons, but also patients like that smoke, for example. Smoking affects the healing ability of implants, bones, as well as soft tissue. So if the patient is a smoker, then you shouldn't really expect a good result. Then the implant fails to integrate, so osteointegration. So the implant is placed into your underlying bone of, like, basically the bone of either the maxilla or the mandible. So failure to integrate, let's say like implants, for example, they come in lots of systems. So let's say if the system that the dentist has chosen does not, or the implant itself, for example, is not made out of titanium, or another metal that does not integrate with the body well, then obviously that would then be a factor in the implant actually failing. And then from there, the implant fractures or it breaks. Let's say like your dentist maybe underestimated the amount of load that the implant can actually handle, and then from there there is damage to the nerve in the mandible. So the inferior alveolar nerve, which is the nerve that runs down your mandible and innervates your teeth, its underlying tissues and parts of your tongue, may be damaged, especially if maybe a good radiograph was not taken, or the specialist or your dentist underestimated the amount of space between the bone and the inferior alveolar nerve. They might actually, in actually placing the implant, drill down to the inferior alveolar nerve and actually cause damage. And then there is damage to the maxillary sinus or nasal cavity. This is very common, especially if now an implant is being placed in the molar region of your palate, or your maxilla, if I should say. Then obviously that proximity to the maxillary sinus may be affected. So considerations for dental implants: the options can be fixed or removable, like I mentioned. So it just depends on what you guys decided on and why. And then it improves the patient's confidence, comfort, as well as social interaction, for obvious reasons. Now it's like the patient has a sense of there's something permanent in their mouth, so they're more receptive to the treatment and they feel more comfortable with the treatment option that you guys have decided on. And then the patient should be in good health, like I mentioned, and should have adequate jawbone and ample healing ability. So good health, extensive medical and dental history, and then with the adequate jawbone, we will be making use of x-rays such as PANS and SEFs to actually check the density, the quality and quantity of the bone. And then obviously with ample bone healing, then diagnostic tests should have been run by your dentist before actually deciding to make an implant. And then assessment of bone density of the jawbone, like I mentioned before, we make use of PAN and SEFs. If there are like more advanced equipment such as CBCT x-rays, for example, then those can also be used to actually assess the bone density that is in the jawbone. And then obviously positive cooperative attitude, because one, it is expensive, two, it is quite time consuming, so we need the patient to actually want the implant and be enthusiastic towards it so that we can actually achieve that high success rate that we mentioned before. Then the treatment sequence. So normally implants take about 2 to 6 months to be placed successfully and to complete treatment. So this would basically involve the meeting and the consultation with the restorative dentist. That could be your dentist. Dentists are also allowed to place implants, especially or are encouraged if they attend courses or do postgraduate diplomas in implantology. And then obviously then would be meeting with the surgeon or the periodontist. So if your dentist themselves are not comfortable placing the implant, then they can actually refer their patients to a surgeon or a periodontist to actually place the implant, and then they then do the restorative work thereafter. A diagnostic consultation is necessary, like I had mentioned before, to assess things such as the quality and the quantity of the bone, and then consent forms and financial arrangements. So with consent forms, you would have actually explained to the patient all the processes, the possible adverse effects, and then from there with financial arrangements, normally the cheapest implant I've heard of is 14,000, but others go to as much as 60,000 rand just for one implant. So obviously then a patient, you guys would then organize a payment plan to actually pay the practice sequentially, or during or even after the 6 months has expired. Then from there, implants will have a surgical phase as well as a restorative phase. So with the surgical phase, we're actually placing the implant. Then with the restorative phase, we're actually then placing the prosthesis that we have decided to use on top of that implant. So the treatment sequence, there are one of two techniques. There is the one-stage technique as well as the two-stage technique. With the one-stage technique, the implant is placed into bone and then it protrudes through the bone. Thereafter, a healing cap is then placed on top of this implant so that debris as well as gingival tissue does not get into the implant. Thereafter, the healing cap is removed. After it is removed, the abutment post is placed. So the abutment post is then placed, so it would then protrude through our implant, and then thereafter healing would then take time of about 3 to 4 months. So that's basically in the one-step technique. With the two-step technique, an implant is placed into the patient's oral cavity, and then it is covered up with gingival tissue and sutures are placed. After about 7 to 10 days, the sutures are then removed. And then from there, healing again still takes place over a 3 to 4 month period. And then after it has healed, a second surgery is then booked where the gingival tissue is exposed, it is basically exposed, and then from there we're checking the implant, we're checking its stability, and then if we feel that the implant is stable and osseointegration has then occurred, then it is then when we place our cap or our abutment, and then once that has occurred, healing has occurred, then the prosthesis is then placed. So there are different types of implants. So we have our subperiosteal implants, our endosteal implants, our mini implants, also known as MDIs, and then the transosteal implants. I don't want to describe the transosteal implants because they're not really all that popular. And then from there, with the subperiosteal implants, these are normally done when patients do not have adequate residual alveolar ridge. This is mainly common in the mandible. So if that occurs, then the implant is placed on top of this bone, and then from there our prosthesis is then placed on top of the implant. So basically that is what happens with subperiosteal implants. So basically over time the patient's alveolar ridge or residual alveolar ridge was worn away gradually over time. So by the time they get to you, there's not enough bone to actually place the implant properly. Okay, and then from there we have our endosteal implants. So these are placed into the jawbone, and this is the most common type of implant, and then they are placed surgically either using the one-step technique or the two-step technique, as I had mentioned earlier on. And then from there we wait for osseointegration to occur, and then we place whatever prosthesis, be it crown, a bridge, or a denture, on top of the implant that is based inside of the bone. So one is on top of the bone, which is the subperiosteal. The endosteal one is actually the one that's integrated into the bone. So that's the major difference. And then from there we have our mini implant. So the mini implant, or the transitional implant. It is the one that was originally used basically as a temporary placement until the real implant heals. Okay, so this is due to its ease of placement, and it is quite minimally invasive and has been favored for its ability to place multiple restorations on top of the implant. So we can also fixate dentures or crowns using this type of implant, especially when spaces are small. So I'll make an example of someone who maybe got a tooth extracted and then maybe lost space in that area due to tooth movement and not doing something about that space. So by the time they get to you, the space where the tooth used to be is compromised. So then we will try to work on in that area using the bone that we have left and the space that we have left, however compromised or reduced it may be. Okay, so they are then designed for stability in soft and dense bone, and this implant can be placed through tissue as well as through bone. And then with the post insertion, it leaves the patient in less pain and discomfort as opposed to a standard dental implant. So it is used for retention, but it is not designed for osseointegrated dental implants. And then the transosteal one, I just really don't want to get into it because it is not all that common to be found in dental procedures. So then your next slide just shows you an example of a dental implant that we can take a look on over there. And then from there we go on to post-operative care. Okay, so this is very important for you guys. So we're going to tell the patient to only consume clear liquids for 2 days. Clear liquids, just to be on the safe side, let's just stick to water. Okay, and then from there softly bite on gauze for 15 to 30 minutes to stop the bleeding. This is very similar to a normal extraction, as you guys should be aware. And then the patient is expected to elevate their head for the first 2 nights. So try and maybe just get a pillow in there just to try and lift up that head accordingly. And then the patient is then advised to rinse their mouth with saline, but not rigorously though, that it might affect like blood clots and the situation in the oral cavity. And then take their daily vitamin requirements, as well as contact the office for any concerns. So if they're feeling like they've lost some form of sensation, they're experiencing discomfort, they're experiencing the beginning of infectious processes, like whatever reason they have, just please encourage them that if there is a problem, they must not hesitate to come back to you guys so that you can nip it in the bud while it's still nice and fresh. Okay, and then dental implant maintenance, so the removal of plaque and calculus. Then the condition of the gingiva and bone should be assessed regularly. So we will advise patients to come to the practice either on a 3-monthly or 6-monthly basis, just to make sure that the implant is sitting properly and they're not having any adverse effects or reactions towards the new foreign material in their oral cavity. And then from there is the use of aids for home care regimens. So these would be the use of floss, the use of proximal brushes, the use of mouthwashes, like things to that effect, just to help the patient then take care of themselves at home. So ladies and gentlemen, the last 2 slides that we covered are very, very important now in terms of the post-operative care as well as the maintenance of the implant after healing has occurred. So like with the clear fluids we mentioned, like water for 2 days as well as milk. You can actually even tell the patient to drink their medication with the milk, and then they must just try and like eat soft foods or like mashed foods during the time that healing is actually occurring. And then from there, similar to extractions like we mentioned before, they're going to bite on the gauze for 15 to 30 minutes to stop bleeding. If that does not occur, same with extractions, ask the patient to come back in for you guys, and then to elevate the head like with the pillow as we had mentioned before, and then rinse the mouth with saline. Please emphasize that the patient must not use a commercial mouthwash. They must just use saline as we are advising in the slides. And then from there, taking off the daily vitamin requirements. These vitamins include vitamin B, vitamin C, vitamin B complex, vitamin C, as well as vitamin D, even calcium, because you know how we all know that calcium assists with our keeping our bones nice and strong. And then from there, if they have any problems, they must not hesitate to return to the practice. And then from there, with the implant maintenance, like we said, either 3 to 6 monthly visits to the dentist, but also more than anything emphasize the need for they themselves to take care of themselves properly when they are at home. So first would then be the removal of plaque and calculus, and then the condition of the gingiva and the bone being assessed regularly. So normally the biggest post-op complication with implants would be peri-implantitis. So that is the inflammation of the gingival tissue around the implant. So this would be due to the patient not taking care of themselves, so there is poor oral hygiene, dietary factors, and even being periodontally compromised as such examples. So basically the patient must basically come in, take x-rays as often as you can, be it periapicals as well as even pens. Like, it doesn't hurt to have as detailed of a file as humanly possible, especially with implants, considering the litigious society that we live in. And then the use of aids for home care regimens. Please know the type of regimens that the patient can use at home. So this could be like dental floss, this could be your proximal brushes, this could be your interdental brushes, this could be your threading systems, this could be your water irrigators, as well as antimicrobial rinses. So those are some of the regimens that we expect you to know that you should be advising your patients on when they are in the dental practice, especially for their routine checkups. Okay, then from there we have our implant retainer prosthesis. So basically this is a prosthesis that we place 6 months after surgery. So this is after we've actually placed our implant, we've allowed it to integrate, we've allowed for healing, we've removed healing caps if necessary, or exposed the implant from the gingiva. So then impressions are taken, and then the prosthesis is then fabricated. So basically with the fabrication of the prosthesis, especially if your dentist has a CAD/CAM system, they can actually design, be it the bridge or the crown, that is going to be placed on top of the implant once healing has occurred after 6 months. So we take an impression, then using the impression or the model that we're going to get from the impression, then we can design an appropriate prosthesis that we're going to place on top of our implant. And then the prosthesis is then placed using either one of two systems. So it's either screw retained or it is cement retained. So with screw retained, this is basically, so we have our implant, we have our abutment. So with the screw retained prosthesis, we have one screw that attaches to the prosthesis that we have selected, then another screw that attaches to the underlying implant that we have placed over the duration of 6 months. Then the other option would then be a cement retained prosthesis. So with a cement retained prosthesis, the dentist will then make use of a transitional cement to actually then place the cement inside the prosthesis and then place it on top of the implant. Transitional cement is then important in this example or in this situation, because should there be any complications, let's say with the stability or the implant's ability to handle a load, or we have problems with infections such as peri-implantitis, we can actually remove the prosthesis and then actually retrieve our implant or correct whatever discrepancy or flaw that there is with our implants. So that's basically that with implants. Nice, short and sweet, right? More than anything with the implants, I think just know how they function, the different types of implants, and in which situations they are used. For you guys especially, I'd expect you guys to then know your post-operative care as well as the dental implant maintenance that we went through, because those are the parts of this process that you guys are mainly involved with. You know, just taking care of the patient, making sure that everything is up to standard, in addition to actually assisting the dentist. So I hope you guys enjoyed that lecture. If you have any questions, comment below. Then yes, I will see you guys next time. Sharp.